Hello, I'm Dr. Obey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we're here again, and I want to state the one thing that I always talk about, and that's caring and sharing. Caring enough about yourself that you go to see your doctor so that you make sure that you have that ability to grow old and grow old healthy. And then once you're caring about yourself, let someone else know that how well you're doing and who your doctor is and your medications are working, so they will go to the doctor and see about themselves. So important that we work as a community. Well, thank you everyone out there for connecting with me. Oh my goodness, Facebook is blowing off the hook. And let me tell you, it's Obey Your Doctor, Facebook. Oh, I just love it. Thank you everyone who's Facebooking me and let me know what you think about the show. Also, the website, obeyyourdoctor.com. Go on there. We have a host of medical information on there. Oh, just go and check it out. It's all good. Well, let's talk. This is our Let's Talk segment. I want to talk this week about COPD, and that's a word that everybody kind of gets scared of, especially if you're a smoker or if you have a family member that's a smoker. Boy, that creates fear in everyone because everyone knows that it can lead to shortness of breath, and some patients are very severe that need oxygen. Well, COPD, what is it? It's chronic obstructive pulmonary disease, and it's caused by chronic bronchitis or emphysema. And emphysema is another one of those words that we worry about. Understand that 85 to 90% of COPD deaths are secondary to people that are smoking. The smoking is what causes the problem. Understand also that there's no cure for COPD. What are the symptoms of this particular disease? Well, I'm talking about coughing, shortness of breath, excessive sputum production when you do cough, not being able to take a deep breath. Those are the type of things that you experience with COPD. COPD is the third leading cause of death in the United States. There are about 12 million patients that have been diagnosed and another 12 million that haven't been diagnosed at all. Interesting. So how do we treat this disease? Well, there are certain medications like bronchodilators. These medications are inhalers. I'm sure you've seen people with them. They actually allow the airways to open up so that people can breathe a little easier. So there are short-acting and long-acting bronchodilators. All right, that's COPD. Well, let's get to the meat of the show tonight. I am so pleased to have someone on the show that, boy, I'm every time I see this person in a hospital, I just have to smile because great things are happening. Just so many great things are happening, and you'll understand why. I'm talking about the president and CEO of Newark Beth Israel Medical Center and Children's Hospital of New Jersey. At this time, I would like to present Mr. Darryl Terry. Welcome to our show.
Thank you,
Alrighty.
Dr. Bay.
Yeah, I just want to say that it's a pleasure having you. I know your schedule is busier than mine, so thank you very much for taking the time to come on the show. It's just so important to have you here. I must admit that I'm on staff at Beth Israel Medical Center, and Mr. Terry and I, we see each other often and we talk and many things, but he recently became the new president and CEO of that medical center. And I'm talking about a large medical center. We are so proud of you, and thank you for coming today.
Well, thank you for having me, Dr. Bay.
All right, so what I want to do, and we're like sitting in my kitchen just talking here,
Okay.
So just relax, and we're just going to talk about a few things. Okay. Tell me a little bit about yourself. I mean, I want to know, and I'm sure the public would like to know, who are you and where you come from? What are you doing?
Born at Newark Beth Israel Medical Center.
Uh-oh.
Right.
Love it. I did not know that.
Born at Newark Beth Israel Medical Center, raised in Newark and East Orange. Went to Rutgers, New Brunswick, Seton Hall for graduate school, and most recently Columbia University for another master's degree in healthcare.
Excellent.
So who am I? I am a married father of 4.5 kids.
No, explain the half.
I will explain the half. So I have Daryl Jr. is my oldest son, Gabrielle. Jordan and Andrew are my two little ones, and the half comes in. My best friend's son, Marcus, has been with me since 8th grade, and he's actually finishing law school this year.
Excellent, excellent.
Very excited about all of them.
Oh,
so
my
they are
goodness.
all the loves of my life. That's who I am. I'm a dad first, then the president and CEO of Newark Beth Israel Medical Center.
All right. Well, I understand family coming first, believe me, because that's so important. I mean, that builds a structure that propels you and allows you, the courage and the confidence to go out there and tackle the world.
Yes.
Yeah, definitely. So let me talk about this. Just step back. Have you always wanted to be in the healthcare arena?
So I didn't know. When I went to Rutgers, I did not know what I wanted to do. But at the time, I had 10 family members working at University Hospital.
Oh, all right.
So I started there. It was a summer job, my junior year of college, and fell in love with the environment. Fell in love with the idea that people come in sick, and we get to return them to their families better than when they came in.
Excellent.
In many instances.
All right. What I want to know, tell me what a president and CEO does. I know there's so many people out there, number one. Well, let me step back for a minute. The fact that you've come to and have been able to rise to such a high position is number one, extraordinary, because I know there aren't that many African Americans that hold this position.
That's correct.
Number one. And let me just state for the record, we are proud of you and what you're doing, because this medical center is not a small little hospital. This is a major medical institution that you're running and doing an excellent job at.
Thank you.
So tell me, what does a president and CEO of a medical center, how is your day? What do you do each day?
So I start off my day around 6:30 a.m. I'll go into my office and I'll say a prayer. And then I'll start my day. But what it really is, see, this is very personal for me. As I said, I was born in Newark Beth Israel. My two youngest kids were born there. My brother died in Newark Beth Israel Medical Center. My grandparents died there. This is a family hospital. So at any given time, I have a family member in that hospital. So I want to treat every patient as if they were my family member. I want them to be safe. I want them to have good quality care and certainly a really great experience. So it's very personal. It's really not a job for me. This is a passion. So, I love being the president of Newark Beth Israel, because I think that there's nobody who cares more about the patients and the community than I do.
Yeah. That's interesting. And so well put. So well put. This hospital, it's rooted in Newark, New Jersey, and it's been a part of this community for so long. Just give me an idea as to how it connects to the community and some of the things that are occurring, so that you can bring the community into the hospital, and how the hospital reaches out to them such that they feel welcome.
So Newark Beth Israel Medical Center has been around since 1901. Now we're part of RWJ Barnabas Health. We're one of 11 hospitals in the system. But Newark Beth Israel is very special. So a couple of years ago, we won an award called a NOVA Award by the American Hospital Association. Only 5 hospitals in the United States won this award. And it was about integrative community wellness. So we are really big in terms of wellness. Like, I always look at Newark Beth Israel as sort of 3 components. One being a community hospital. It's a large tertiary medical center.
All right, tertiary. Explain tertiary.
Acute care. So we do the heart complex care. We do the heart transplants and lung transplants and cardiac surgeries, which you don't see in a community hospital.
Right.
But Newark Beth Israel is a family environment. I know that you've been involved with Newark Beth Israel for many years. I won't say how many. But so what we do with the community hospital component is we have a men's health day, we have a women's health day, we have the Alma Beatty Health Fair that we close down Osborne Terrace and create an opportunity for people to get health education, awareness, screenings. So we're really big into wellness right now. We're really trying to change the dynamics of waiting for someone to get sick and treating them in the hospital. We want to create the opportunity for people to be well and stay out of the hospital.
Right.
So that's a whole new shift, a whole new paradigm for us as far as keeping people out of the hospital. But when they do get sick, when people do, and people will get sick, that's the best place to go because we have some of the best doctors, clinicians anywhere at Newark Beth Israel Medical Center and Children's Hospital of New Jersey.
Right, right. Tell me about, I know that the ER there is a busy place.
Yes.
It's a busy place. And when someone comes into the ER, I know that there are greeters, there are people that they assess the patients. How does that all happen? How does that all coordinate in the ER, moving patients through and doing such a great job down there?
So we see about 90,000 emergency room visits a year, which is pretty significant.
That's a lot.
And we see everything from some of the primary care stuff that should probably be in an office setting, in a doctor's office.
Right.
However, for whatever reason, patients often come with primary care issues into our emergency department, and they're certainly welcomed and treated well as well. But we really try to connect them with a physician so that they can be in the right place for their care.
Right, right.
So we have, as I said, 90,000 emergency room visits. We have patient advocates, nurses, techs, everyone working together on behalf of the patient to try to create a really good experience for our patients. Now, sometimes it's not fast, right? We struggle with that because it's a lot of people coming in, but we want to make sure that we provide high quality, safe care more than expedient care. We want to make sure we get it right, and we do.
Yes, yes, I can attest to that. I understand, I was reading somewhere that you have 3,500 employees. So in thinking about this, this is a major employer as far as the city is concerned.
Yes, we are. We are an anchor institution, certainly in the South Ward. We employ 3,500 full-time, 3,500 employees, about 25% coming from Newark. And that number is growing each year because we have a lot of initiatives in place to hire Newark residents. Right. We created a program recently with Barnabas Health and some other employer partners called Hire Newark. We took 16, the first class was 16 individuals who were had a difficult time finding jobs. Right. And we took them through a 5-week training program. At the conclusion of that training program, we hired them.
Excellent.
So many of those kinds of programs don't have jobs at the end of them. We wanted to make sure that we actually had jobs prepared for the recipients. And it was a great program, very well received, and we're doing 2 more classes in September.
Excellent, excellent. And just to give you some size of this, I was amazed to know that you're up about 1,000 physicians now are credentialed at this hospital.
Yes, we broke the 1,000 mark early last year. And that's what really makes the employees and the physician is what makes Newark Beth Israel and Children's Hospital special. We've always had some of the best physicians anywhere, and I think that's been why we've been successful. You've seen many hospital closures, and we've been successful, and it's mainly by getting the right physicians and supporting them.
Right, right. Okay, then. Now, let's just talk about some of the services that you're talking about. Let's just step back just for a minute. I know that you said that this is a tertiary center. Tertiary also means that there are a lot of patients referred to other hospitals to this hospital because this hospital has a level of care that other hospitals may not be able to rise to. And so I'd like to talk about some of the special services like the heart transplant or the lung transplant. Tell me about these.
So I call these destination services. So this is bigger than the Newark community. We get patients from all over New Jersey and outside of New Jersey for our destination services. We have one of the most comprehensive cardiac programs anywhere in the Northeast.
And cardiac, you mean the heart program?
Heart program. We're in the top 5 in the nation in the number of hearts that are transplanted. We are in the top 3 in the nation in the number of TAVRs, or transaortic valve replacements.
Okay, you just went way over
my
head there. So this is, let me see if I can explain it. This is the valve, the last valve before the blood goes into the body pushing out into the body. That valve is the one, and when patients get old and that valve doesn't work, there's a new procedure that they can do without surgery and push the catheter in the new valve up and release it.
That's right.
Into that area, and it works without major surgery. Am I right?
That's correct.
All right.
Initially designed for older people
Right.
who could not withstand an open chest.
Okay.
And so now we're one of 2 sites in the United States that got approved for lower risk patients now.
Excellent.
So
Excellent.
we're able to do some more minimally invasive cardiac procedures.
Excellent.
We have pediatric cardiac surgery at Newark Beth Israel, the most comprehensive pediatric cardiac surgery program in the state of New Jersey, and we do that in conjunction with NYU. We have the most advanced pulmonary program anywhere,
Right.
and certainly in the Northeast.
And pulmonary, you mean by lungs?
Lungs,
Right,
yes.
Right.
And the only lung transplant program in the state of New Jersey.
In the States, huh?
Yeah. So anything asthma related, anything to do with the lungs or the heart, we're probably your place to go for those types of activities.
Excellent, excellent. Now I know that when you have preemie babies,
Yes.
and the neonatal ICU, and the reason I know so much about this is because my daughter, when she was born at Beth Israel, she was a preemie, and she spent a month in the neonatal ICU and needed surgery and all. And she is a beautiful girl now, just graduated college. Hurrah!
God bless.
So tell me about this place, because that's a premier unit for you guys.
So in 1996, when United Hospital closed, we became the Children's Hospital of New Jersey.
Right.
So we have all the specialties available for kids right here in Newark, so that patients don't have to go into Philadelphia or New York for these services. Our NICU is second to none.
Right.
We get patients from all over the state of New Jersey in our NICU. It's just absolutely amazing. When I'm having a rough day, I will go into the NICU and look at those courageous babies and those courageous moms and dads who are supporting them. I mean, there are babies that are born that you can fit in your hand,
Right.
that ultimately come to full strength and discharged from the hospital. Every year we have a NICU reunion, and hundreds of kids come.
Right.
And we got Harvard graduates. We have the whole gamut of, and it's great for the families. It's sort of like a fraternity, if you will, of people who were born and spent time in our NICU.
Right.
The last time I went to I go every year.
Right.
This past year, we had a heart transplant patient who successfully delivered twins, and they were at this NICU reunion, which just I had goosebumps all over just knowing that we were a part of first the heart transplant and then successfully delivering twins. We don't know whether that's ever happened anywhere. I can't say that it has, but has it? But.
Excellent, excellent. Let me talk about the cancer center too. I know that your cancer center is boy, it's been there for a long time, and you have Dr. Alice Cohen, who's the chief at this particular point, but it's a really, really impressive place. Tell me about your cancer center.
So Dr. Fred Cohen, Alice's dad, is sort of known as the father of oncology in New Jersey. He's 89 years old.
Oh my goodness.
And he still practices.
I love it.
He's still one day a week.
Okay.
But Alice is the director of that program, and the cancer center is actually named after him. It's the Fred B. Cohen Comprehensive Cancer and Blood Disorder Center.
Excellent.
And we see not only oncology patients, but hematology or sickle cell patients in that center. And we have a 6 board-certified hematologist-oncologists, as well as a fellowship program in oncology at Newark Beth Israel.
Excellent, excellent.
In addition to that, so what a couple of years ago, we saw that we were seeing too many women with stage 3 and stage 4 breast cancers.
Oh, all right.
And so we worked hard with the Healthcare Foundation of New Jersey to create a new breast center. It's a brand new center. It's beautiful. It's state of the art, and it's something that's really welcoming to our women. And so now we're actually starting to see the needle turn, where we're seeing more stage 1 and stage 2, where there's more curative. So what we want is prevention. We want early diagnosis, so that treatment outcomes are better.
Okay.
And so that's something that was really important to me, and it's something that we were able to do for the women in Newark.
So you're talking about the breast center, it's education as to teaching patients or women how to examine themselves,
Absolutely.
how to catch it early, because I know in the African American community, breast cancer is usually caught late.
Yes.
And that's a problem. It's a big problem, because if it was caught early, then the prognosis or the ability to treat it appropriately and save lives would be much better, much better. So the whole key is to get this diagnosed early.
Yes.
I'm telling you, what a great thing. So this center recently opened up, and now patients can come in. All they have to do is call the hospital and ask for an appointment. How do they connect to this?
Absolutely. You call the breast center number or call the hospital. We'll patch you through. We take all insurances. It's very important. And once a year, we actually have a breast cancer screening where even if you don't have insurance, we certainly want to take care of our community.
Right, I understand. Robotic surgery.
Robotic surgery.
The newest thing on the block.
Yes.
I mean, everybody's getting into robots.
Yes.
Tell me about it.
We have the most mature robotic program in the Northeast. So many years ago, when the robots first came out, we were a training site. So when you see robots proliferated all over the state now, many of the physicians learned how to do the procedure at Newark Beth Israel Medical Center. So now everybody has robots. Most places have robots, but they don't have the teams that we have and the experience that we have in robotic surgery. So we have great outcomes. We've had patients that have come as far as from France to see Dr. Savada is one of our urologists who was an early adopter to the technology. We have Dr. Tani, who's OBGYN, Dr. Patrick Anderson, an oncologist, surgical oncologist. So we have some of the best doctors, and I'm gonna get in trouble for starting to mention names without mentioning them all.
Right? I know. I was like, whoa.
Shouldn't have went down that. But all of our doctors at Newark Beth Israel in the surgical robotics area is very experienced and have great outcomes.
Excellent, excellent. All right, we're going to talk about a lot of things, and I trust I had more time. It's only a half-an-hour show. Oh yeah, for those of you who just visited or come into the show, we're talking to Darryl Terry, who is the CEO and president of Newark Beth Israel Medical Center and Children's Hospital of New Jersey. All righty. Let's just state this, that it's important, and I know it's important to you to connect to the community, but as far as patients coming into the hospital and feeling comfortable with the hospital, I understand we take care of the patients, but the families as well. You know what I mean? That the families of these patients feel comfortable and welcomed as well. That's an important thing. Tell me about that, because I know that you try as a community to make it just a community effort, you know, in the hospital as well as outside of the hospital.
We're absolutely focused on the patient experience. So we have a patient experience department, and they help with some of the family issues, some of the social issues. Of course, we have a full array of social workers for some of the social activities and needs of our patients and their families. So we look at the families as an extension of the patients. So when we're treating the patients, we're also working very closely with the family and providing education so that when that patient goes back to their family, that they're able to understand whatever was going on or is going on with the patient. We see a fair amount of chronic disease, and so managing that in a good way to keep people out of the hospital again is something that's really important to me. I really want to reduce the amount of people, and that's counterintuitive to have less people come in the hospital. But I really want to have a healthier community. I'm really focused on that. I look at some of the statistics on infant mortality and some of the things that Newark is always lagging the rest of the state. And it's my goal as president and CEO to really change some of those metrics.
Okay.
Of course, not alone with the team of great physicians that we have, but we want to really get out into the community. We want to gain trust and credibility so that we can help people help themselves with healthy eating, exercise, education, awareness, screenings, early treatment. So, you know, ignorance is not bliss. You really need to go see your doctor and really take advantage of all the screenings, and let's find out if something's there. Oftentimes, if it's caught early, it's very treatable. And you know, we have and you know, especially guys.
Let's talk about guys.
Especially guys, we have the tendency to sort of wait, and that's not a good thing.
You know, we're down to about a minute left. So I definitely want to, and I just want to tag a few of the special services that the clinics. You guys have an array of clinics, and you know, senior care clinics. You have the HIV clinics. You have the travel medicine clinic, which I know personally because I used it before, and the wound care, the bloodless surgery. There's so many things that we didn't get a chance to talk about. But if there's something that you really want to close out with, what would the one thing about Newark Beth Israel Medical Center? We have maybe about a minute, but I want to give you that time to close out.
You know, what makes Newark Beth Israel Medical Center and Children's Hospital special is the caring individuals who work there. The employees, the nurses, the physicians, the management team. We are absolutely committed to creating a healthier Newark, and you can feel it. The energy is palpable. We are committed to safe care, high quality care, and we certainly want to create a really good patient experience. So, you know, I kind of long for the day where we go into a senior's home and fall-proof it. To make sure that that senior is not coming into our hospital. Yes, we can repair a broken hip. We don't want to repair a broken hip. We want to prevent it from happening. So we're trying to create partnerships with our communities so that we can keep them out of the hospital and have them have great quality of life.
All right. Well, Mr. Terry, thank you very much. Thank you so much for coming in and sharing all of your knowledge about Newark Beth Israel Medical Center. Oh, goodness gracious. This is a great day. Number one, you being the CEO, and number two, connecting to the community the way you do. All righty. So, in closing, let's talk about closing. Sharing and caring. Don't forget, share and care your medical, do good for as far as your medical care, and then share that great information with somebody else so they can do better. Remember, the website, www.obeyyourdoctor.com, and hook me up on Facebook, Obey Your Doctor. Never institute any change in your medical care before you consult your physician. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.